You're watching Unicef television. As part of World AIDS Day, international experts gathered in New York to discuss how to deal with the ongoing HIV/AIDS crisis in the face of the global economic downturn.
And I think that doing more with less suggests that when you're faced with an economic crisis and you have little to go on, that's when you become the most inventive, the most focused, the most efficient, and therefore the most effective. And that's what's needed right now. So I think it's, instead of thinking of the crisis as just a crisis, it's a good moment in history to think about, well, we have limited resources, how do we best use them? And for children, in particular, who are the most vulnerable and often the neediest, it's particularly important to figure out what do we know through evidence that works and that we should be spending the limited dollars on rather than trying to apply a vaguer approach, a more general approach.
Today we release, along with WHO and UNAIDS, the annual progress report on scaling up prevention and treatment. And amazing progress has been made, particularly in the last decade. So for example, 400,000 children infected last year under the age of 5. That's unacceptable, but it's a 30% drop than just 5-6 years ago. 23% of kids have access to treatment. That's still not enough, but it is an increase.
You have to actually come back and focus and say, how much money is this? Can we accept this cuts? Shouldn't we be fighting these cuts? I saw Jeffrey Sachs was writing that it's 1 day of the US military's expenditure to provide the funding for the global fund. When banks in Wall Street, just around the corner, were looking like they were going to fail, they found the money too big to fail. But apparently children are too small to count. And so the real question is whether or not UNICEF will take the steps to ensure that, and others, to ensure that we just don't accept these cuts and that we don't have to face the consequences, because really, are we saying that international banks are more important for our future than our children?
I think that, in reaching marginalized communities requires first identifying who they are and why they're marginalized, what are the barriers and the attitudes in society that prevent them from receiving the services, and then actually going out and providing what they need, where they need it. And I think UNICEF has done a pretty good job with that and now has a refocused effort to do that even better with the new leadership of the executive director who has called upon us to look at those who are the most disadvantaged, the most marginalized, and figure out how to reach them, because they are the ones who, we've done the easy job. We've sort of dealt with those who we can reach. And it behooves us now to get the rest of the job done.
Younger children sell better. They make for better UNICEF, Save the Children, whichever, they make for better adverts. A little child there on the picture when you're on your email. See it, you want to click. You see a teenager, a risk-taking teenager, they're not getting my wallet, that's fine. But a little child, they get my wallet. And that's highlighting the fact that it's because it's at a distance. We're trying to sell a good cause. It's as if the developing world, we were, robbed of land, minerals, people for some point. And now it's our emotions. You want the little children to try and make it, people at a distance feel better. But older children just don't lend themselves to that. And we should be clear about that. We should be saying, you know what, it's not about you. If you want to really make a difference, you have to accept it's not about you. And maybe giving money to a risk-taking teenagers program doesn't make you feel as warm inside. But that's okay, because that's the right thing to do.
One of the most exciting things that I've seen in the last few months, and it was before I came to UNICEF, was work that is being done out of the regional office for Eastern Europe and Central Asia. And this is an area in HIV. This is an area of the world where the epidemic is truly driven by injecting drug use. If you think about it, 90% of the world's heroin flows out of Afghanistan through into Central Asia, across into Russia, and to Eastern and Western Europe. So that area of the world where young people have a devastated by the impact of injecting drugs. And it was a publication really on street-connected, young sex workers and injecting drug users. It really gave a very graphic and painful reality to what was going on, but addressed the concrete and very simple things that could be done to improve the lives of these young people and set them on course for what would hope to be a healthier and a more productive life. And I think that was a very courageous document. People in that region are working with countries to try to get the governments to address this problem and realize that these young people deserve as much of a chance as the young people who manage to escape the threat of drug addiction in that region.
You've been watching UNICEF Television. Unite for Children.